There are three important principles to help guide a conversation about advanced care planning. The first is we want to normalize advanced care planning. Traditionally, we have saved this conversation for people who are seriously ill, newly diagnosed, or having a crisis. What we want people to feel like is that this is an important preventative conversation that we have with anyone over the age of 18 to think about their health care. So when we're approaching patients, there's not going to be this panic of, oh my goodness, she or he or they are coming to talk to me about advanced care planning because I'm all of a sudden very sick, and rather that this is an important conversation to think about what my long-term healthcare goals are, that I inform my family members and my loved ones and my healthcare team of what my wishes are. So first we want to normalize advanced care planning. The second thing we really want to make sure that we do is that we're really emphasizing overarching values. So while advanced care planning and advanced directives are important, the most important thing is that we really are having this conversation about what is important to patients and their families and what they value in terms of health care in the event that they're seriously ill. There are 30,000 scenarios that we could get into about the details of what a person would want. For example, if you have metastatic lung cancer and you all of a sudden are in need of dialysis, do you want that? If you have liver disease and you can't swallow, do you want that? There are lots of scenarios that we could come up with, but the important thing is that we know if a person values pain and symptom management, whether they're alert and oriented, what type of comfort measures, etc. So we really want to focus our conversation on that. And then finally, we want to be able to follow a person's lead. So that goes back to one of the main tenets of motivational interviewing is that we are starting where the client is, starting where the patient is, understanding that if we jump way ahead and a patient isn't ready, then that might backfire. So we're honoring where they are and journeying with them on this, going at their pace. And here again is the roadmap graphic. And just as a reminder, throughout this whole process, we need to be listening, reflecting, and offering empathy, or we're not going to make it to the other end. So that listening, reflecting, and empathy is sort of like the gas that fuels the car that gets us from point A to point B. So as a reminder, we're going to start with that values assessment we just talked about, asking patients about their values and preferences and setting up that conversation, followed by completing the advanced directive. So asking people about what their preferences are, assessing decision making, and then reviewing that document, exploring what kind of treatments they would want, and actually helping a person complete those documents. The next step being helping folks choose a healthcare agent, so a person who would follow out their wishes in the event that they cannot. And then having the conversation, so involving family is often a very, very difficult conversation. So coaching people through that, working through questions that might come up, and also talking to the healthcare team, which can be a difficult topic to bring up at times too. And then finally, informing people about that post-most form, and explaining when that form might be useful in the healthcare trajectory. When we're thinking about the values assessment, I think the most important overarching big picture is really getting a feel for the patient's desire for quality of life versus length of life. And so really teasing out, would a patient value time with family, ability to travel, less hospitalization over length of life? And so again, just having that broad conversation with open-ended questions, with empathy, with reflection, in which we really explore and learn where patients are on this seesaw. And there are many ways that we can start this conversation with a patient or family member. So starting out with, if you were so sick that you couldn't do most of what you like to do, what would you want? Or another way to put that would be, what would you want if you were very sick and unlikely to get better? And we can expect a full range of responses. Some people might say, I want every treatment available to me, even if there's little hope of getting better, no matter what it costs, no matter pain or discomfort. Somebody might say, I want to try out some different treatments over a period of time. And if they aren't working, then I would like to shift. And then some people might say, I want to be comfortable as possible, even if it means that I might not live as long. And of course, some people might not know. But I think as we go into this conversation, it's important to shift from sort of a binary dichotomy of dialysis or die, that it's, go at 100% full throttle or you die, and really expanding that to what is some of that gray area that we can be in. Are there things that we can do along the way to help increase comfort measures? Can we try dialysis, and if it's not working, pause? But exploring and expanding options is really an important approach. There are many outstanding resources available. The first resource we recommend is the Prepare website, which has information for patients and providers, and it will connect you to your state's advanced directives. In addition, we have the My Way coaching guides and patient guides. The Coalition of Supportive Care of Kidney Patients created an advanced care planning guide for patients with kidney disease and a coaching guide for people that work with patients with kidney disease that is available for free on our website using these links. While having a conversation about advanced care planning is of utmost value, it is also important that we have documentation of that conversation and documentation of the advanced directives. Every state has different advanced directive forms, so it's going to be very important that you use your state's advanced directive. Again, the Prepare website should connect you to your state's advanced directive, but those are usually free if you just Google your state's advanced directive. It will be important that you know what your state requirements are. For example, in the state of North Carolina where I live, advanced directives have to be notarized and witnessed by 2 different people. So make sure you know what those requirements are, and it's really helpful if you can also sort of direct patients and family members where to get that notary done. Making sure that your facility has a consistent place to put the advance directive is really important so that everyone knows where to look for that advance directive if there's a need, and just having a consistent practice and process for putting that in the medical record is important. But in addition to that, making sure that you write your own notes with the document is important. So any information that might be helpful for the healthcare team to reflect the conversation that you've had with patients and values is important to include. And finally, use the app that we've created as a tool to help you track your patient progress as well. So we want to make sure that we are documenting our goals of care conversation in the electronic medical record. So any conversation that you've had with a patient about what their overarching goals and values are should be documented. The advance directive should be documented as well. And remember, some states have an advance directive form and a healthcare proxy form. The post or most form should be documented. And there's also an advance directive registry. And so if that is an option to document the advance directive in a registry so that that's available in multiple settings is an option as well. Finally, some additional resources available to you would be the Prepare for Your Care website, the POST or most patient site, so a site for patients to access information about those post forms. And then VINCA has quite a bit of information about advanced care planning conversations as well. And here again is the roadmap graphic. And just as a reminder, throughout this whole process, we need to be listening, reflecting, and offering empathy, or we're not going to make it to the other end. So that listening, reflecting, and empathy is sort of like the gas that fuels the car that gets us from point A to point B. So as a reminder, we're going to start with that values assessment we just talked about, asking patients about their values and preferences and setting up that conversation, followed by completing the advance directive. So asking people about what their preferences are, assessing decision making, and then reviewing that document, exploring what kind of treatments they would want, and actually helping a person complete those documents. The next step being helping folks choose a healthcare agent, so a person who would follow out their wishes in the event that they cannot. And then having the conversation. So involving family is often a very, very difficult conversation. So coaching people through that, working through questions that might come up, and also talking to the healthcare team, which can be a difficult topic to bring up at times too. And then finally, informing people about that post-most form and explaining when that form might be useful in the healthcare trajectory. 3 important things to remember with the values assessment piece are, first, we want to ask patients about their values, preferences, and goals. This is a key component of providing patient-centered or client-centered care. So the conversation doesn't start out as, do you have an advance directive? But the conversation starts as, I'm wondering if you can tell me about what your hopes about your future healthcare are and what concerns about your future healthcare are. And from that, we begin to understand and unpack what the patient's goals, values, and preferences are. The second component is again starting where the client is first. If the client has got an urgent pressing need that they want to address, and we are ignoring it so that we can meet our own goals, we're not going to make any progress. So we have to start where they are first and remember those motivational interviewing principles of rolling with resistance. So if a person is not ready to talk about advanced care planning yet, that we are holding space for where they are, because that's part of the relationship building, trust building process. And then finally, being thoughtful about how we set up that conversation, so that we're introducing the reason for the conversation and we're asking permission to give information. So, setting that up again often comes back to, I start with a sometimes statement. Sometimes I hear that when patients have been on dialysis for a month or two, or whatever that scenario is in your case, that they start to have questions about their future health care or concerns about that. I just wanted to have a conversation with you to find out where you are. The next step on the roadmap is completing the advance directive. So, really getting an understanding of what your patient and family member know about their illness, and what do they know about the trajectory and what things are going to look like, and how much information do they want to know. So again, we have to be thoughtful about where to start this conversation and how, using the prompts we just talked about. We also want to be able to assess their decision-making capacity. If it seems like someone needs additional support, really trying to determine who it is we need to talk to in the family, and making sure that our conversation is not full of medical jargon and terminology, and assessing along the way what a patient is able to understand. So sometimes I'll be like, can you sort of share with me in your own words what it would mean to you if we documented this, or this, so that I can be sure that a patient understands that process as well. The next stage is reviewing the advance directive. So going through that form with the patient and family member and really asking about what their preferences are for life-sustaining treatment. So lots of different components there. Often we're thinking about whether a person wants to be resuscitated or not, but there are also questions about whether a person wants mechanical ventilation, IV fluids, feeding tubes, with also consideration for if a person has advanced dementia, if a person is unlikely to get better, etc. So really going through those scenarios on the advance directive, making sure we know what the patient's wishes are and making sure that we respect those. And we want to complete those documents, if appropriate, according to the patient's goals and wishes. So helping the team also be able to know how to respect those wishes is important. The fourth step is helping choose a healthcare agent. And I say fourth step, again, remember this might be the most important step. And it's okay if along this roadmap that you've got some windy twists and turns and roads that sort of go off, as long as they bring you back to the goal of helping your patient and family members be clear about what their wishes are. So sometimes that means we have to start with a healthcare agent. So really identifying a surrogate in the event of incapacity. So oftentimes that's a question of, who would you want to carry out these wishes that you've identified in the event that you can't carry them out yourself? This is a really important part. because we know that without having a conversation about who that person is, um, the healthcare team is likely to just follow the aggressive treatment route if a patient is hospitalized. So we really want to spend some time choosing a healthcare agent, helping patients and family members understand that that does not have to be next of kin, but that should be a person that the patient really feels confident is going to follow through on their wishes. The next step is having the conversation, which honestly can be one of the most important pieces because I think this is often where patients and family members struggle is how do I bring up this really delicate topic with the people that I love that might react to this, right? Like I can expect there might be some emotion if I bring this up with my family. So what we want to be able to do is help our patients talk through this process because really an advance directive without conversation with family members is probably not very helpful. Um, and so that means we have to help kind of tease out what does the family member know about the diagnosis? What do they know about the illness? Because sometimes if family members have misinformation, they might have expectations that are not in line with what's realistic. How involved are they? Um, and if this is something that's difficult for patients and family members to engage in, being able to sort of help them cope through this. How have you had difficult conversations in the past? What's been successful? So we're really trying to empower patients using strategies that have worked for them in the past rather than our own solutions. And then we're going to, work through whatever challenges or concerns they think are going to come up. And so that might mean that we role play. What is that going to look like to have that conversation? A lot of times I will ask family members to just, or patients to just explain to me what they think is going to happen if they raise that topic with a family member. Because often when people start speaking it out loud, it becomes easier to go back and have that conversation as well. I also think it's important to give some space to having a conversation with other medical team members. So certainly you will be able to be a conduit between the dialysis team, but are there other people that the patient should share this advance directive with? Other providers, other institutions like hospitals, etc. This can be an intimidating topic for a patient to bring up to a doctor or another healthcare team member. So really kind of helping think through that and coaching a patient through how to address having this conversation with other team members is important. Finally, if the patient has filled out the advance directive, we want to ask permission to put that in the medical record. We want to talk to them about the post-most form and give information about that. And just helping patients realize that the more we communicate with the healthcare team about their preferences, the more likely they are to be followed through. So really, again, asking permission. Would it be okay if I placed your advance directive and medical orders in the hospital dialysis center medical record? And can I file it with a registry so that we can make sure the people that are interacting with you know what your healthcare wishes are and are able to follow through?